questioning.
Well, thank you very much, Mr. Chairman. Mr. Secretary, thank you for being here. I particularly appreciate your enthusiasm for using artificial intelligence to enhance productivity at HHS. I think in your testimony you said the AI revolution has arrived, and we would agree with you. I was the chairman of the House Artificial Intelligence Task Force last year, and we produced a report in December that had a whole chapter on healthcare because we believe that there is no industry in the United States that's going to be more radically transformed by AI than healthcare. You also testified about the healthcare cost challenges that we're facing in this country, the fact that we spend between 2 and 3 times per capita what other developed countries do, and we achieve worse healthcare outcomes. And I think you and I share a belief that AI can help with that. So I'm delighted that you are applying AI to make HHS more efficient. I think you testified you're using it to expedite drug approvals, which is wonderful. I'm wondering, though, if how we can catalyze attacking it from the provider standpoint, because we have physicians that spend twice as much time on administration as they do on patient care. And we've got reports from think tanks that indicate that if we utilize AI effectively, we can cut 10% off of the cost of providing health care to Americans. So what can HHS do to catalyze the adoption of AI and the securing of those benefits on the provider side?
We are doing that at every level of the department, and I'm surprised it's only 10%. It's just the waste, fraud, and abuse, and particularly the fraud. AI has the capacity to detect fraud now. And we're using it in the department for that reason. We're using it for diagnostics. We're using it for paperwork. The agreement that I made yesterday with the pharmaceutical companies should cut off much more than that from paperwork from doctors. And so we're using it everywhere that we can, and we hope to drive it into the healthcare system in this country at every level, including the providers.
Right. Well, I think that there's no more powerful pulpit for evangelizing that than the post that you hold. And so I hope that you will help drive that, because it's not enough that just HHS uses AI to increase its productivity. We need to make sure we get this adopted within industry and within the provider community. And a follow-up question on that. I've been talked to stakeholders across the industry about what they're doing to use AI, using AI to improve healthcare. There is a large level of frustration with organizations like CMS, and I don't think it's intentional. I just think it's a big bureaucracy and they're kind of hidebound, where someone comes up with a really revolutionary AI-based, I don't know, a diagnostic tool or a treatment option, but there just isn't accommodation in the system for it. There isn't a billing code, or there isn't a recognition that these can lead to cost savings. So, you know, we want to be good stewards of taxpayer money as well, but how can we change the rules to make sure that we're saving the money that we should be saving with AI?
We need people at Medicare, at Medicaid, and at CMS, leadership that is absolutely committed to this transformation. And we have that today. We have Dr. Oz, we have Chris Klump, and who came out of the tech arena and is now using his knowledge to transform what we do there. People send me every day of the week. People are sending me innovative ideas that sound wonderful, and we have a way to screen those now. I send them over to Chris Klump. I send them over to Clark Miner. We brought people in just to do AI and that kind of transformation. And those ideas are being explored one at a time, and the ones that work are being innovated, are being introduced and integrated into our system. So we're doing that today. You're going to see major changes over the next 4 years.
Right. Well, I'm very happy to hear that. I think it's going to require a partnership between the executive branch and us here in the legislative branch to make that possible. And if you haven't read the health section of our task force report, I'd encourage you to peruse that, because we're going to need to work together to get this done. But thank you very much for your testimony.
Thank you, Congressman.
The gentleman yields.